Teresa Freed with Johnson County Government. It's our goal to stop the spread of COVID-19 in our community. We also want to make sure you have the latest information on our efforts. For data on how COVID-19 is impacting the county, visit our dashboard on jocogov.org.
My name is Dr. Joe LeMaster. I am the local health officer for Johnson County. So what are some of the differences between the flu and coronavirus in the way that it presents? We know that the flu season is on us now. We're starting to see flu cases appear in the community. We're pushing everyone to get their flu vaccinations. So what are the differences? Well, the flu is fairly consistent in the way that it appears and when the symptoms happen. We all have had that or had some experience with that in our family. Sudden onset of high fever, headache, body ache, what we call prostration, which means fatigue, inability to keep things down sometimes. Sometimes you feel that you can't get out of bed. This can be a way that COVID presents as well. In a large study that was done up in the University of Washington among people that were positive for COVID, about a third of them presented this way. But most of the rest of those who had COVID presented in very different ways. It can sometimes look like the common cold. This is less common. This would be symptoms of nausea, vomiting, diarrhea, certainly cough, but also runny nose, those sorts of symptoms. One thing that shows up with COVID, in symptomatic people with COVID, which we don't see in either the flu or very often in the common cold unless you're very stuffed up, is the loss of taste and smell. This is something a lot of people have talked about. In terms of shortness of breath, it's true, and we are concerned, and if you have the symptoms of shortness of breath, then that definitely should be something that you get checked out, either for the flu or for COVID. It is slightly more common in the COVID situation with cough, shortness of breath, and fever, as we've said many times. But you can see this in the flu as well, especially late in the course of the flu, if you develop what we call post-flu pneumonia. The majority of deaths that happen by flu are people that had the symptoms of flu early on and then were starting to get over it and develop pneumonia. This happens more in the older population or in people who have a problem with their immune systems. This can also happen with COVID. People can start to get over the COVID symptoms and then have a second sickening, as they call it, where they become more short of breath and develop changes in their lungs on x-rays that we can see, and then at that point their oxygen levels can go down. This could happen in either the flu or in COVID. So it's important to know that if you become sick with symptoms that look like the flu, go get tested, both for the flu and for COVID. It could be either one of them.
For more information about COVID-19 in Johnson County, visit jocogov.org/coronavirus. You can also subscribe to a daily e-newsletter with the latest data and precautions being taken in the county and state.